Oh, no, I don't. Are we good? Good morning, everyone. Thank you so much for joining us today. We really appreciate you expressing or sharing your interest in climate change and health. We have an exciting session ahead of us. And to kick things off, we're going to see a short video from Professor Himla, who's the Executive Officer of the Academy of Science of South Africa. Please join me in virtually welcoming Dr. Himla.
Greetings and welcome all. I'm Himla Sudyal, the Executive Officer for the Academy of Science of South Africa, and it is my pleasure to announce our partnership with the Inter-Academy Partnership to host this side event at Glasgow. Colleagues, the topic for discussion today is on climate action to protect and promote health, sharing knowledge among regions to focus on solutions. Now, we have heard a lot about the ghastly effects of climate change, the 1.5 degrees Celsius carbon footprint that we should all be aware of, and the ways in which climate change has been affecting us in multivariant ways. However, I just wanted to present a few aspects of work that ASSAf has been doing, like this partnership with Leopoldina and the Inter-Academy Partnership that we will hear about. Earlier this year, ASSAf also launched its second biennial report on climate change, in which various local experts contributed in the drafting of this document, highlighting why we all need to be aware of the effects of how we behave today in securing the futures of tomorrow. Also, ASSAf is currently involved in a forum on the topic of a just transition. And essentially, as we have heard our president announce earlier this week, that we need to move from a process of utility of coal for providing energy to a low carbon, climate resilient, inclusive and equitable economy and society in South Africa. Now, how we do this is going to be very, very critical, because as we move in the just transition, we need to pay attention to the skill sets that would be necessary to take people who currently use manual labor, particularly in the utility of coal to provide energy, in terms of providing alternate resources for energy. So we have a long road ahead of us. And in essence, as the Academy, we need to use science, more specifically evidence-based science, to promote science advice to policy makers. And in addition, given that the Academy has many, many networks, it is our responsibility to communicate the science to the general public. Moreover, there are many stakeholders nationally, regionally, and internationally that we are part and parcel of. And if we all work together to facilitate the goals of the Paris Agreement on climate change and the Sustainable Development Goals, we will be making dents in the current landscape to provide a better future for one and all. I look forward to the discussion this afternoon that's more nuanced towards the health aspects. And once again, I wish to thank all our partners for being willing to participate today, and we look forward to an interesting discussion going forward. Colleagues, let's join forces to ensure that we provide a future that the following generations to come could be proud of. Our actions today will dictate what sort of future the generations to come will have. Thank you so much.
So thank you to Dr. Himla for that great welcome. The next video is presented by Dr. Volker. He is going to provide an introduction to the Inter-Academy Partnership and this specific climate change and health project. He was the co-chair of the Inter-Academy Partnership between 2017 and 2021, and he also acted as the co-president. Please join me in welcoming Volker to Meulen.
Dear participants, the Inter-Academy Partnership is a global network of academies of science, medicine, and engineering, which was started in 1993 and is located with its headquarters in Trieste, Italy, and with an office in Washington, D.C. at the US National Academy of Sciences. IAP has more than 140 member academies with over 30,000 leading scientists, engineers, and health professionals. Moreover, our member academies have formed regional networks in Africa, Asia, the Americas, and Europe, which can operate independently or jointly, like in the global project on climate change and health, which is discussed in this session. The strategic priorities of IAP are capacity building of national member academies and regional networks, to empower academies and networks to provide independent authoritative advice to society and policymakers, to communicate the importance of science, engineering, and medicine in terms of research, education, and public discourse, and to build IAP as a progressive and resilient global academies network. The idea to take up the issue of climate change and health by IAP was discussed first a few years ago in ASSAc, the European Academy Science Advisory Council, which is IAP network of Europe. At that time, politics in Europe discussed climate change and its effects, but without including health aspects such as cardiovascular diseases, respiratory diseases, new infectious diseases which migrate from the global south to the north, and different types of mental health problems. European academies therefore carried out a study on this issue and discussed in their report the known possible effects of climate change and health for Europe to bring scientific evidence to the attention to policymakers as well as to society. When the report was published, it received a lot of attention, not least from parts of the European Commission and from the European Parliament, where we presented the findings. This positive response with this report led to our present IAP Global project. With the financial support by the German Ministry of Science and Education, we could start the IAP Global project on this issue by involving our IAP's regional networks in Africa, Asia, and the Americas. We are currently nearing the final stage, having produced 3 additional regional reports and drafting currently a global synthesis report with the aspect to finish at the first quarter of next year. These reports describe regional similarities and differences and advice for policy makers. It is obvious that such a major project needs coordination in order to achieve regional reports which can be compared. Based on previous experiences, we know that the science base has to be sufficiently broad to integrate local, regional, and global aspects. Moreover, an agreement on the following points has to be achieved: a common starting point for regional activities, a strong consensus of controversial issues, recognition and appreciation of diversity, and of course, follow-up at local, regional, and global levels. Moreover, one needs to find an agreement on the key questions which each regional network will be working on in order to prepare later a global report. In this global report, we will draw on the regional assessment of climate change effects on health to focus on solutions of mitigation, adaptation, and cooperation. In the following presentation, some aspects of our regional climate change and health work will be discussed.
right, so now we're going to move on to the live portion of the panel presentations. And I'd like to encourage you to think of questions as we go through the presentations. At the end, we're going to have a Q&A session, so you can come up to the microphone and ask any questions you have of any of the panelists. And also, if you're tuning in online, feel free to pose a question online as well. So our first speaker is Sir Andy Haines. He's going to provide a welcome from the Royal Society and also an introduction to global issues for climate change and health. Sir Andy Haines is a professor of environmental change and public health at the London School of Hygiene and Tropical Medicine. Please join me in welcoming Andy.
Thanks very much, Shirley. So, as Shirley has said, what I'm going to do is provide a brief kind of overview, introduction of the global action that you've heard about through the Inter-Academy Partnership, and also say a few words about the Royal Society Academy of Medical Sciences report, which focuses very much on the UK and documents some of the health benefits of climate action. So, as we know, climate change has a range of impacts on human health. That's it. And you can see from this slide, summarizing these many pathways by which climate change impacts on health, that these can be divided into three broad categories. The direct effects of climate change on health. Extreme heat, for example. We know that death rates increase during exposure to extreme heat. People cannot work, they cannot, their productivity goes down, their labor productivity, and that's particularly important for those engaged in physical labor, like subsistence farmers and others, whose livelihood depends on their physical labor. We also know that extreme heat has effects on pregnancy. Pregnancy outcomes increases the risk of preterm birth, for example. And then there are the less direct effects of extreme events like floods, droughts, that can have direct and indirect effects on human health through a multitude of pathways. Effects on human health through infectious diseases, food, waterborne diseases, vector-borne diseases like malaria and dengue. The effects of wildfires, causing inhalation of toxic smoke and increasing death rates. And of course the effects on food systems, which are so crucial, decreasing crop yield, decreasing the availability of staple crops, and of course fruit, vegetables and other food groups that are essential for human nutrition. And finally, the category of social factors, so increasing poverty, population displacement, and probably conflict as well. So these regional reports and the Global Synthesis report describe these different impacts that are relevant to the regions under consideration. They focus not just on physical health, but also mental health. They include discussion of the mental health effects of environmental change, emerging concepts like solastalgia, the distress caused by environmental change, which has been observed in a number of populations around the world as their environments are disrupted, their habitual environments are dramatically changed, and they exhibit signs of grief and mental distress. And many studies have also shown an increase in common mental disorders for considerable periods after floods, droughts and wildfires. As you can also see, there's a correlation between suicide rates and extreme heat exposure in some countries. What types of actions can we take? Well, there are two broad types of actions. There's the adaptation action, so adapting to climate change as far as we can, creating more resilient health systems, food systems and so on. And this slide just summarizes the kind of actions that can be taken to address extreme heat. You can see that this involves the engagement of a number of sectors, not just the healthcare sector, but also other sectors as well. For example, in urban situations, urban governments, urban planning and so on, community outreach, community organizations reaching out to vulnerable communities. So we need integrated surveillance and early warning systems to warn about extreme heat exposure coming up, and then to put in place policies to enable access to cooling centers, distribution of water, targeting vulnerable groups, including those people living in informal settlements, in elderly care homes and schools, and other vulnerable locations. And it's a combination of actions ranging from the individual action, the actions through the built environment, for example, more green space in cities, which helps to cool cities, and of course, also healthcare systems themselves, that we are able to reduce the health effects of climate change. So we can adapt, we will be able to adapt up to a point, but there'll be limits to adaptation, and maybe in some cases those limits may be being approached even now as we speak, because some populations will find it very difficult to adapt, including subsistence farmers, for example, who are forced to work outdoors. So the other element of climate action, of course, is mitigation. This slide summarizes some of the key issues here. As we move towards clean energy, we can also reduce the air pollution exposure that kills many millions of people. Transport systems also, reforming transport systems can also help to improve health through reduced air pollution, increased physical activity, and of course food systems, moving towards more sustainable diets, reduced consumption of red meat, for example, in high-consuming populations, increased consumption of fruit and vegetables, which can help to prevent a range of non-communicable diseases and reduce greenhouse gas emissions. This slide shows you the numbers of deaths we might be able to prevent by phasing out fossil fuels, because as we burn fossil fuels, we create air pollution, fine particles which get deep into our lungs, particles that are about 1/40th of the size of a human hair, the diameter of a human hair, and these get deep into our lungs, causing a range of adverse health outcomes, increasing the risk of heart attacks, strokes, chronic lung disease, and so on. And the map shows you where these deaths are concentrated in Southeast Asia, in Southern Asia, in Europe, and North America. Less so in sub-Saharan Africa, because less fossil fuels are burnt in those kind of locations. But if Africa, for example, does increase its burning of fossil fuels, then of course death rates will increase. Much can be done in cities. A lot of work is going on through C4 cities, through ICLEI and other urban networks. And we know that a number of cities are putting in place actions to decarbonize their economies. A study done a couple of years ago showed that about 61% of cities surveyed were implementing climate mitigation actions to cut greenhouse gas emissions. And those cities that reported co-benefits, including the benefits to health, were more likely to take action, to take decisive action, than those that did not. So emphasizing and reporting on the benefits to health and to broader society may help to motivate action and to garner more public support for the actions that need to be taken. The food system is absolutely vitally crucial, of course, to mitigating greenhouse gas emissions. About 30% of greenhouse gas emissions come from the food system, including methane, which is a powerful short-lived greenhouse gas, of course, from ruminants and also from rice paddies. So our dietary choices have a major impact on climate and, of course, on our health. The Eat Lancet Commission reported a couple of years ago. It was a really groundbreaking commission, and they articulated this vision of what they called the planetary health diet, which was a diet much higher in fruit and vegetables, nuts and seeds, lower in red meat and other animal products than many high-income countries currently consume. And they estimated that this could prevent perhaps 10 to 11 million premature adult deaths per year by mid-century. Of course, this is not a uniform diet around the world. It would have to be tailored to different cultures, to different traditions. But it gives us a broad direction of travel, which will have benefits for the climate as well as human health. Nature-based solutions are increasing interest, of course. This slide summarizes some of the health benefits that can arise from so-called nature-based solutions, like ranging from protecting existing mangroves and forests to modified ecosystems such as farmer-managed natural regeneration, agroforestry, and new ecosystems, newly created, like green roofs, for example, would be another example of that kind of approach to NBS, nature-based solutions. And the slide summarizes a few of the benefits that might occur from protecting nature, like reduced malaria, for example, reduced air pollution, less forest burning, cleaner water, and so on. And restoring mangroves can also enhance freshwater quality and reduce the risk of flooding. So if we're to make progress on health, we need to integrate health into broader development strategies. The SDGs, of course, help to frame human development. SDG 3 is specifically on health care, but there are many other SDGs which are crucial to health, including those that reflect also on the climate change agenda, like clean energy, like SDG 13 on climate change specifically, like sustainable cities, just to give a few examples. So health is very much at the center of the SDG agenda, but it can't be addressed by healthcare systems alone. So let me, in concluding, just say a few words about the Royal Society and Academy of Medical Sciences report, which focused particularly on the UK. And it does focus on the health benefits of moving towards a net zero policies in the UK setting. Of course, one of the areas that's crucial is the reduction in air pollution from reducing fossil fuel burning. And in fact, there's a separate report which has just come out from the Royal Society on air pollution and climate change, which goes into some detail about the effects of climate change on air pollution and the beneficial effects of climate change mitigation in reducing air pollution. But this slide focuses more on the transport system. It shows us how active travel can benefit human health and reduce greenhouse gas emissions. So, for example, if we get the urban population of England and Wales walking and cycling like the population of Copenhagen, that could prevent many patients having diabetes, stroke, heart disease, and other conditions that are related to physical inactivity. And one study that we came across documented potential savings to our healthcare system amounting to about the equivalent of about $25 billion over a 20-year period, something of that order, as a result of increased active travel. Sustainable diets, I've already mentioned them. The example from the UK would be that if we could optimize the UK diet to meet the WHO nutritional guidelines, that would reduce greenhouse gas emissions from the food system by about 17% and could increase life expectancy around 8 months if the whole population of the UK was consuming that kind of diet, which is more involves eating more fruit and vegetables and less red meat. And then finally, housing. Many benefits from retrofitting obsolete housing to make it more energy efficient, warmer housing. But it's also important not to seal up houses too tightly, because if you do that, then you get more household air pollution. So it's a question of getting the right balance between ventilation and insulation to achieve the optimal health benefits. And many, of course, as I've already mentioned, many of these interventions on green infrastructure can potentially benefit human health as well as the climate by reducing heat exposure, for example. Finally, healthcare systems themselves. We've heard here at COP that healthcare systems are quite a major source of greenhouse gas emissions, 4 to 5% globally, some countries much more than that. Many of those emissions come from supply chains, as shown in this slide. Those supply chains relate to the medical equipment and pharmaceutical industries. So working with those industries to help them decarbonize their supply chains is an important contribution to reducing the greenhouse gas emissions from the healthcare system, as well, of course, as moving to zero carbon energy. And finally, making sure that we don't have negative impacts. So, for example, as we move towards employment in the low carbon sector, ensuring that there's a just transition from those jobs that are based on fossil fuels to those that are based on clean energy, managing job insecurity, and in making sure that we address and anticipate occupational hazards of net zero jobs, for example, in offshore wind. And also guarding against unintended adverse consequences from international spillover. So at present, for example, we export a lot of e-waste, including to West African countries, and they're often processed in very hazardous circumstances involving child labor and so on. So reducing that and ensuring that we don't unintentionally increase the risk to other populations through cobalt mining, e-waste recycling, and so on. So a number of key messages about integrating the protection and promotion of human health in all actions to address climate change, coordinating and integrating adaptation and mitigation measures, regular assessment and reporting of health impacts, and promoting a systems approach. So I will stop there, and I will now invite some of the regional report leads to present their findings of their regional reports in summary. And I'll turn first of all to Shirley, who's already introduced herself. She's the Canada Research Chair in Climate Change and Health and an Associate Professor in the School of Public Health at the University of Alberta. Shirley, over to you.
Thank you. Okay, it's such a pleasure to be here today to present to you an overview of the report that focuses on the Americas. And outside, there's some handouts, and there's including one overview of the Americas report. So if you're interested in more details on this report, please pick this up. And the full report itself will actually be released in the coming weeks, so stay tuned for that. So when we first started this project, the authors on the authorship team who are from across the Americas, one challenge that we were faced with was how are we going to do this assessment report considering the diversity that exists in the Americas? We have different climates ranging from, Arctic climates to the Amazon, small island states. There's a huge diversity of climate and geography, but also a huge diversity in culture and peoples, including a lot of really important indigenous peoples in the region as well. We also have high, middle, and low-income countries to cover. And so when you think about this diversity, we were really puzzled by how we were going to do this. So one approach that we took was to include case study examples. And the case studies throughout the report sort of highlight some areas for depth and nuance, but then at the same time, we also provided a broader synthesis of what we were seeing and observing in the research across the countries in general. And one case study that I wanted to highlight in particular was a really strong one that is about Indigenous peoples and how climate change is impacting the health of Indigenous peoples and what they're doing to respond. And this section was led by Indigenous peoples themselves. So what did we find in the report? Well, we have 5 key overarching messages that are based on science that's been produced over the years. And the first is that climate change is impacting health now in the Americas. It's impacting all countries, all regions. It doesn't matter if it's a high, middle, or low-income country. It's impacting everyone. And that's important and that matters because if climate change is already impacting our health now, we know that it's only going to continue to impact our health into the future under 1.5 degrees warming, but especially under 2 degrees warming. And you can see in this map from the IPCC that there are particular regional hotspots where these impacts or where the hazards will be experienced even more so. And the health outcomes as a result of these hazards and exposure and vulnerability are widespread. And in the report, we cover everything from heat-related morbidity and mortality to different infectious diseases to mental health and well-being. And for each of these health outcomes, we assess what we know based on research on the current impacts that have already been experienced, what's expected or projected to happen in the future, and also specific adaptation or interventions that could be done for each of these health outcomes specifically. But these health impacts don't occur in a vacuum, they never do, and I think that COVID made that really clear for all of us. So another thing that was really important for us to do in the report was to address this and to look at the science around it and to look at how climate change converges with other health crises. And in the example of COVID, we looked at a number of different case studies and examples, including, like what happened within the health system when they were already grappling with COVID and then hit by heat waves and having to deal with increased heat mortality and morbidity. But we didn't only assess the literature on the challenges that we're facing and experiencing, we really tried to focus as much as we could on solutions. And solutions that are supported in research and in the evidence. And it makes it really clear that climate change action can improve health across the board in the Americas. And we have an entire chapter devoted to this in the report. And the first part of the chapter focuses on adaptation and how it's really important for the health system to work across sectors to really fully grapple with and respond to climate change impacts on health. But we also focused a lot on mitigation, and not just mitigation in general, but how immediate mitigation efforts can result in immediate health outcomes. Sometimes in the report authors were hearing in their countries that we need to take mitigation, but it needs to be slow and thoughtful. But what we really wanted to highlight was that the evidence actually shows that immediate action can provide immediate benefits. And we do this through different case studies, including coal phase out, mass active transport, and low emissions diets. And one thing that became very clear as we went through the report was the importance of equity and justice. And that has to underpin all of these actions if we want to have any measurable success. And one way that we did this in the report was to examine it through the Sustainable Development Goals. And this is an adapted figure from the IPCC report on 1.5 degree warming. And through the report, we tried to illustrate through case study examples and through research on climate change and health how all of the Sustainable Development Goals have to be addressed in combination with achieving some sort of decarbonization to really develop climate resilient Americas. And so based on this massive effort that included authors from all different countries across the Americas, indigenous peoples, non-indigenous peoples, we come together and we looked at the evidence and we made clear recommendations. And this is really important because a lot of reports that exist on climate change or on climate change and health aren't able to be policy prescriptive. But we didn't shy away from this. We made very clear recommendations that are grounded in science and grounded on evidence on what different decision makers, healthcare professionals, researchers can do in the face of climate change impacts on health in the Americas. So when we started the report, the diversity of the Americas was a clear challenge for us. But as we worked through the report, we realized that the diversity of the Americas actually became a strength of the report because we were able to highlight a diversity of impacts, but also some of the underlying pathways through which climate change impacts health and some of the commonalities in responses across regions. And some of these messages you may have already heard at COP from other people, but what this report does is it provides the evidence and the research behind these recommendations and these comments and provides a resource for different people, whether it's healthcare professionals, decision makers, or researchers to turn to show the evidence for these recommendations and for these comments. So thank you very much.
Thanks very much, Shirley, and it's a great pleasure for me now to introduce Dr. Dheeraj Corsi. He's an independent epidemiologist offering integrated epidemiology solutions to a variety of contemporary issues, including climate change and health. And he's the working group chair of the African Working Group on IAP's project on climate change and health. Dheeraj, welcome.
Thank you, Professor Haines. A very good morning to all of you. The previous speakers have made my job a lot easier because I don't have to go into the background stuff, but what I will present, the report we did for Africa. Africa, as you know, is the most vulnerable continent to climate change and health, and our vulnerability stemmed from 4 fronts. We have a high prevalence of climatic hazards. Our geographical features varies a lot, just like in Americas. We have many types of climate, from tropical to equatorial to coastal. And then we have a lot of vulnerable people who stay in the continent because of low income and middle income. They have low adaptive capacity. And the health system is already overburdened to deal with the existing diseases. Take the example of one hazard, for instance. Take the effect of heat. What heat is doing is already melting the ice on top of the Kilimanjaro mountain. That melting of the ice is leading to the change in the pattern of the flow of the water, affecting the agricultural practices of the community who stay there and the whole way of life. So you can see how one system impacts on the other one. Similarly, we have other interacting pathways that previous speakers have outlined, but they all directly or indirectly lead to economic, social, and health impact. As far as health impact is concerned, on the graph on the map on the right-hand side here, you can see, again, Africa has the highest disease burden mortality due to climate change, according to WHO estimate. The burden can be as high as 120,000 additional deaths attributable to climate change alone. And the prediction is dire. So, So how do we deal with it? With such an enormous burden of disease, we have to have a deal in a concerted manner. One way is to introduce a public health package where we protect the people the vulnerable people, everybody, against the effect of climate change. The simplest way to do it is to have an early warning system that will enable us to anticipate, to predict, to monitor, and to manage the climatic hazards and the diseases that are associated with it. Now, you cannot install like a silo, an early warning system sitting by itself. What you have to do for it to be sustainable, you have to integrate it within a plan. And one of the commonly used plan is the NDC. When you see from Africa, this is the latest report, we're doing pretty good for NDCs. Most of our countries, in fact, we're doing better than the rest of the world, including health in NDCs. But including health is not enough. We got to go beyond that. You got to make it into a plan of action, formulate it. And what is missing in most of the African countries is that we do not have health incorporated in the NDC. And the way to do that, why is that happening? Because the sectors are talking to each other. Ministry of Health and Ministry of Environment often work in isolation, and there's no intersectoral collaboration. A good tool to do that is to promote the health in all policy of WHO. So we have the limitation there. That's why it's not happening. This is not the only limitation. When you look at the access to Green Climate Fund, this is not happening on a wide scale in Africa. Why? We definitely have some limitations. What are other limitations we have? Well, we lack a database. Policymakers need information in real time to be able to formulate a policy that is evidence-based. We do not have a database for the hazards, climatic hazards, in time and space, and nor do we have the disease that is linked to it. When compiling the report, it was very difficult to find Africa-specific mortality, even for a simple thing like flood. You would think it's easy to count. So we need to have this database to link it together so policymakers can have the information they need. The other one we need is to have a collaboration to do research, because policymakers, again, need information. In absence of information, they can argue any way they want. We need to show that mitigation have co-benefit in health. But most of the countries in Africa do not have the capacity to undertake such research, and therefore we need to partner up. One way we can do a nature-based solution that most of us have addressed, we need to empower the local community who's been living with climate change for a long time and have indigenous knowledge how to deal with it. So that can include some of the approaches that Professor Haines mentioned, diet change, switching from coal to stove cooking, and also introducing the greening in urban planning. That it was one good example from Côte d'Ivoire in our report. Now, both mitigation and adaptation will have benefit, as Professor Haines has mentioned. Obviously, the immediate need for Africa is the adaptation, but we cannot ignore the mitigation. The COVID pandemic have worked havoc on our economic and our health system. But it also gives us an opportunity to come out with, to introduce and sustain green technologies for mitigation. But sustaining and introducing such technologies require enormous financial commitment, which most of our countries do not have. So my take-home message for you is that climate change is happening now in Africa, and it's a problem that doesn't belong to one border of a country or a continent or a region. It's a global problem. It requires a global approach. So my earnest message to you is that we need to partner to support us in our effort so that we can carry on this work further. We having COP, the next COP will be in Africa, so we can come out with some more concrete results. Thank you for your attention.
Thank you very much, Dheeraj. And you point to the next COP in Africa, where we hope that health will be even more prominent than it is here. So our next speaker is representing the Asian perspective, Professor Ho Kim. Professor Ho Kim is the Professor of Biostatistics at the Graduate School of Public Health in Seoul National University in Korea, and he's representing the Health Working Group, Climate Change and Health Working Group for Asia. He's pre-recorded his presentation, but he will be joining us live for the Q&A session. So we look forward to hearing from Ho Kim.
Hello, I'm Ho Kim from Korea. I'm very happy and excited to have a chance to participate COP26 side event related to climate action and health. Today, I'm going to summarize our report titled The Imperative of Climate Action to Promote Health in Asia, which was recently published by the Association of Academies and Societies of Sciences in Asia. Firstly, I'd like to acknowledge the funding agencies and all the members of working groups from 15 national academies. In our report, we characterize the vulnerability of Asia and Oceania as follows. Number one, it is an area in the world with highest population and has countries with the highest population density. It has some of the longest stretches of coastal areas. And number three, it is home to some of the most densely populated cities. Number four, it is dependent on agriculture-based economy, which is in turn is dependent on monsoon winds carrying seasonal rains. We also summarize the major health effects, such as direct heat-related outcomes and indirect heat-related outcomes, forest fires, climate and flooding, allergy, fertility, infection-related diseases, and food and nutrition security and agriculture, and climate change and environmental toxicity, and forced migration, as well as mental health. And I think we did some research on especially fertility problems in our region. We also stated main adaptation and mitigation options. That is number one, the Asia and Oceania regions need an integrated mitigation and adaptation strategy tailored to its own needs to combat the effects of climate change on human health, society and environmental problems after implementing international agreements. Number two, developing countries are facing difficulties in implementing mitigation and adaptation plans for several reasons, such as economic and social capacity and lack of trained human resources compared with developed countries. And we also demonstrate several case studies in our report also. Lastly, we provided 5 recommendations according to evidence-based data. Number one, education and training. Number two, research and knowledge implementations. Number three, integrated healthcare facilities, services, and implementation. This is also a very difficult problem with the COVID-19 problems. So this is new and very challenging problems, I think. And number four, government support in policy development. Number five, financial aid and adequate resources. This is my short report, and I will be happy to have time to discuss with all the other participants in a moment. Thank you.
Well, thank you very much, Professor Ho Kim. Let me now turn to our final speaker before we come on to the interactive session. Dr. Robin Fears is Director of Biosciences Programme at the European Academies Science Advisory Council, and he's the project coordinator of the Inter-Academy Partnership. He's worked across a range of different actions in terms of biomedical science and innovation within the European policy environment. Robin.
Thank you very much. Good morning to you all. As Andy said, my task next couple of minutes is to tell you a little bit about the European contribution to the IAP Global Project. This is our report. In fact, it was published in advance of the other regional reports and helped to scope some of the starting points for the other regions. Of course, those starting points and the issues for discussion were subject to rigorous scrutiny before we expanded the project globally to explore impacts of climate on health and solutions. As this report was published a year or so ago, I won't go into the detail because you can read that online or in paper copies. Just to say that our recommendations were categorized into these 4 areas: relating research and policy, relating research and communicating to the public at large, particularly context of countering misinformation, using the evidence already available across the sectors. Health issues aren't just a matter of the health sector, and also generating new evidence. I won't go into more detail on any of these points. I want to update you on a couple of more recent activities, but I do just want to emphasize that one of the big issues for Europe and European policymakers is that we have to understand that the decisions we make in Europe do have implications for regions outside of Europe. That's not always taken into account in our domestic policy decisions. Okay, so I'll move on to work that was published this year by ESAC in conjunction with FEAM, the European Academies of Medicine Network, where we looked at issues for decarbonisation of the health sector itself. Andy has mentioned earlier this morning some of the pioneering work done by the NHS in the UK in decarbonising health systems. And just to reiterate what he said, that there's a number of ways that we can approach net zero in health systems through systems change. It includes, for example, green hospitals, sustainable procurement in the supply chain, and innovative models of care. So, for example, telemedicine and digital health can help to contribute to decarbonisation as well as to improved healthcare. Again, you can read our conclusions in this publication, and there are copies outside. The point I want to make today is that, yes, indeed, the health sector can do much for itself in moving to net zero carbon targets. But this transformational change can be accelerated and supported if there is a supportive policy environment. So many European countries, sadly no longer the UK, can be supported by policy developments at the EU level, for example, to develop sustainable procurement, and there are initiatives in Europe along those lines, including in the pharmaceutical sector, and a number of policy actions related to the European Green Deal and the sustainable economic recovery after COVID. And our report goes into issues to relate those wider policy developments to the particular targets for health sector, for example, in terms of sustainable food systems in procurement and sustainable construction and the digital health strategy. My final example, again published this year, this is published last month and is available online, this link, is a study in the Mediterranean that covered a number of countries for an extended Mediterranean region, including Southern Europe, North Africa, and the Middle East. And in fact, some of this work was presented last week at a session at the EU Pavilion. The Mediterranean is a major climate hotspot, but nonetheless, the conclusions that our workshop developed are relevant to other areas. The recommendations are being taken forward in collective activity across the Mediterranean, and I hope also in engaging with EU policymakers. And the point I want to make in my final slide, relevant to today, is that yes, there is a significant research agenda to take forward in the extended Mediterranean region, as in the other regions that you've heard about this morning, and indeed that the scientific community has a responsibility to help guide that research agenda. But in addition, we can do more to use the evidence that's already available, and we shouldn't wait for new research in order to act on the evidence that's already available in order to proceed with our mitigation and adaptation solutions, both at the regional and at the national level. I want to spare as much time as possible for our discussion in Q&A, so I'll stop there. But as I mentioned, all of the points that I've covered are already published and can be found on our website. Thank you very much.
Thanks very much, Robin. So now we have about 20 minutes or so for questions and responses from the panel. And Ho Kim, I believe, is also online live with us from Korea. So welcome to you, Ho Kim. Very good to see you in person. Hopefully you'll be up on the screen before too long. So questions from you, points that you want to raise with the panelists. As you will be aware, the reports are quite lengthy reports, and it's really only been possible to give a few headline findings and recommendations here. So please feel free to ask the various panelists for more detail about the reports, or indeed to speak to them after this event if you want to know more. So questions, please come to the mic at the front if you wouldn't mind.
Hi, thank you all for your great presentations. And my question is around the recommendations in all of the reports. There were some really solid recommendations and comments about the importance of collaborating with institutions, governments on NDCs in the local context. So I'm wondering what you are doing professionally to follow up on the recommendations in your reports, if you have collaborations such as these, or how you as leaders in the Academy are pushing forward the recommendations that are coming out of your reports.
Thank you, great question. Any other questions at this point? Yeah, please come forward. We'll take 3 questions and we'll batch them all up and then ask the panelists to respond.
Thank you so much, panel. I thought it was absolutely fascinating what you were saying, particularly the way that you brought together all of the regions of the world with very different needs in each of the regions. I found it absolutely fascinating. That coupled with the draft agreement that we've seen this morning, which I think is largely really good news, but I can't see any mention of health in that draft agreement. And it would seem to me that co-benefits is a really useful hook to hang health into the final agreement, perhaps through regional activity. And I wondered if the panel, or indeed anyone in the audience, might like to discuss how we might bring health into that agreement, and notably looking at co-benefits. Thank you very much.
Wonderful question. Thank you so much. Great question. And third question, anyone else ask anything? Yeah, please. Oh, another one. Okay. Right, yeah.
Thank you very much, Ariane. I was wondering, Shirley, if you could give us some more detail on some case studies from the indigenous people and how they're responding to the climate change over there. Just some more detail on it. Thank
Great. Well, I know there's another question, and we'll come perhaps to you in just... Or do you want to ask yours now? We'll take perhaps all 4 questions together, because we only have about 20 minutes. So please come to the front.
My question was about education. I think the young people will be those that will be really facing the big problems. And so education is very, very important. Just by the way, I mentioned, I am from the French Academy of Science, and we have created a foundation, okay, for education to climate change, okay?
Oh, fantastic.
OCE, Office for Climate Education, that's important. And I want to know if you have recommendations in all your reports about this important point.
Great, thank you very much. So wonderful questions. Let me perhaps just ask you to respond. Dear Raj, do you want to go first?
Thank you. I think the role of the academies, we work at different level. We make the policies, and that my other colleague will also elaborate on this. The remaining question, I think, there was to Sherry Lee, I think. And education is there in our report, of course. There are many more recommendations, like Andy said, we just get bullet form, but there's capacity building, training the healthcare workers to recognize and deal with it. Educate at every level, the community, the citizen, the government, and with a policy, how do you follow up? We have a way to follow up. We do reports, surveys sometimes. We see how many of the recommendations have been implemented. That's what we do in NASAC usually. We do regular survey together with ASSAf. And then we distribute the policies. Of course, distribution doesn't mean it gets to the place where it has to get to, but we follow up how many of the recommendations have been implemented.
Okay, I understand Ho Kim is online, and I believe you can hear us, Ho Kim. Did you want to respond to any of the questions?
Yeah, do you hear me?
Yes, very good.
Yes, thanks for the excellent questions. In Asia, especially, I think the people, the influence of international agencies like WHO is bigger than those influence in the developed area. So people in general are listening to the guidelines of international agencies. So that is one of the characteristics of Asian countries, I think. So we need strong messages from not only the governmental agencies, but also international agencies also. So that's something I can tell. And most of the evidence is not so clear so far. So we definitely need more scientific researches to provide more scientific evidences for all the consequences, especially for the indirect effects and the infectious diseases. The relationships are so complicated, but we need more basic researches on that field also. And the other thing is that education, of course, education is very important. I believe in the developing area, still people think that the economy is much more important than human health. So how to communicate with them and to provide them a good idea is very challenging for us. So the developing education is another big problem for us, I think. And one interesting characteristic of Asian countries is that we have diversity in many, like many other areas, but we have diversity in developing, economic development for each country. So we have developed area and developing area all together. So we need very different approaches so that, but we can do some experiment on some countries also. So those are the thoughts from my side. Thank you.
Thank you very much, Ho Kim. Let me move on to Shirley. There was a specific question to you, I think.
Yeah, sure. Yeah, so really great questions. Thank you so much. In terms of the Indigenous content in the report, one thing that is really striking to me as I read through the report is that the other sections really focus on like risk and risk reduction. But the section that was led by Indigenous peoples talks about it more from like almost like a strength-based position, and how the environment and the land actually is a source of wellness, and how it's a source of health, and how we need to protect that. So I think the framing was very, very different, and there are lots of really great examples of Indigenous peoples responding to climate change impacts on health, and that includes things that individuals and families and households are doing on a day-to-day basis. But it also, you know, like comes up to this international level as well, and I think there's a lot of really amazing leadership from different Indigenous organizations here at COP who are taking this and moving it. And to the first question about, you know, how do we take this information in this report and mobilize it, I think that's such a critical question. And for the Americas report, this is something that we were talking about from the very beginning. And I think part of it is mobilizing the individual authors. So from the very, very beginning, we talked about communications plans and how we're going to do that. And I think that because there's such a diversity of authors from such a diversity of countries on the report, I think that that will help. And of course, the different academies and royal societies generally have pretty strong relationships with governments and with decision makers, and hopefully we'll be able to leverage that to move forward. And one of the plans in Canada, for example, actually links into this question about education, which was a key theme in our report as well, and taking that report and working with different like NGOs for youth outreach in elementary schools actually, and taking the information in the report and turning that into interactive fun modules that can be used in schools. But of course the report also talks about the importance in higher levels of education and that as well.
Robin, would you like to comment?
Have said that the reports are an important part of the project, but in a sense that they're a first step, a big first step. But indeed, we recognise the critical importance of continuing to invest in following up what we're already communicating and building further dialogue. All of these issues develop over time and require interaction between the authors of the reports and others in the scientific community and other stakeholders. And I think the academy structure that does allow for that extended follow-up, both at the national level through national academies, at the regional level through the regional working groups that you've heard about, and indeed at the global level, and we have a global report which synthesizes the regional activity appearing next year, and that obviously can be followed up at a global level where there are common shared interests. As I mentioned in my own earlier presentation, in Europe we published our report a year or more ago, so we have already had an experience of following up quite intensively over the last year at the national level. But certainly at the EU level as well, where we have engaged several times with the European Commission and the European Parliament, as well as successive European presidencies. It's always difficult, of course, to identify early impact and attribute that impact to what we're saying, because there are, of course, other bodies saying other things. But I think it has helped, our work at the EU level has helped in some small way to raise the visibility of health issues in conjunction with climate change. And obviously that's a very important question as to how we can continue to do that, to do more to raise visibility of the health issues and the solutions. And indeed, I think some of us would feel that the original ambition of the UK presidency was a little bit lacking on the health side. Just coming finally with regard to education and education of the next generation, yeah, I mean, this is critically important, of course. I might just mention, and you can find it on the IAP website, Inter-Academy Partnership, does have an initiative on climate change education globally, mediated for a number of countries, and you can see the work on the website. It's at a relatively early stage yet, so the focus has been on explaining climate change rather generally, rather than the particular health issues, and rather than the solutions to climate change. But IAP has made a start, and that will continue.
Thanks, Robin. If I could just respond to a couple of the questions myself. Very important questions about the role of health at COP, and I think fully agree with the tone of your questions that health has been more prominent here than in previous COPs, and yet it's not really still integrated into the main work of the negotiations. It's not reflected in those. So there's a lot of side events going on, but I get the impression often it's the health community talking to other members of the health community. One of the issues is that we tend to conceptualize health as being largely a function of the healthcare system. But what we've tried to indicate is, yes, of course the healthcare system is vitally important, but the determinants of health reach well beyond the healthcare system. They're related to, obviously, the environment and to social determinants as well. So if you really want to achieve a high level of health and a sustainable world economy, you have to design and implement intersectoral policies that will promote health and climate change mitigation and adaptation. And that's a strong message, I think, that's coming out from all of these reports. And of course, the World Science Academies are a great way to integrate the perspectives of different disciplines and different sectoral contributions. And so I do think that it's helped to raise awareness of the multiple determinants of health, many of which are out with the control of the healthcare systems themselves. That's not to undermine or in any way diminish the importance of decarbonising the healthcare system. And we've certainly been delighted to see the contribution of the NHS here. And as we've seen, there have been now commitments from about 50 nations to develop, on the one hand, climate resilient health systems, and a number of nations, about 14 I think it is, have also committed towards decarbonising their healthcare system. So these are important commitments. But we also need to move beyond the healthcare systems and see how policies can be implemented across broader society to sustain health, adapt to climate change and mitigate climate change. So that is a challenge for the future. I think in COP27, I believe, having discussed this with some of our African colleagues, that health will feature much more prominently. Africa is already, of course, experiencing many health impacts of climate change, and there's a lot of interest in Africa both in adapting to the climate change that they're already experiencing as far as they can, and I think for the future, also moving towards a clean, low-carbon economy which can support and sustain health and avoid some of the problems that the so-called developed nations have had in having their economy based on the exploitation of fossil fuels, which, of course, as we understand, can't happen in coming decades. So that's going to be a big challenge, and I am reasonably optimistic that health will be much more central in COP27. We can take forward some of the lessons learned here to ensure that it is reflected much more prominently in the kind of negotiations and the recommendations that come out of a COP. What we've seen health, as we've already heard, health has been mentioned in a number of the NDCs, the nationally determined contributions. Those of you who participated in the WHO conference on Saturday heard some of the work that's been undertaken by the Global Climate and Health Alliance, where they've been mapping out how health is reflected in the NDCs. And it's quite an interesting analysis, because what it shows is that the high-income countries actually don't reflect the healthcare benefits of decarbonisation very much in their NDCs. Low-income countries are much more likely to mention health, both in terms of the impacts of climate change on health, the potential for adaptation, and to some extent mitigation as well. So there's a lot of work to be done to ensure that health is much more embedded in the nationally determined contributions under the Paris Agreement. But of course, the NDCs don't solve the problem. They, in themselves, they have to be implemented. And so I think the implementation agenda, how we actually implement some of those commitments, document the impacts of some of those commitments on health and on greenhouse gas mitigation, are going to be crucial for the next few years, really to get beyond some of the broad commitments and the modelling studies that have been done, right down into documenting the implementation and the impacts of climate action on health and greenhouse gas emissions. So we are running out of time, but I just wonder if is there a final question? Yes, at the back, please. Come, oh, two. Well, make them very, very quick, and I'll ask the other panelists to respond really quickly.
Hi, yes, I'll be brief. What opportunities, in addition to hearing you speak, the reports, are there for implementing partners to engage on functional exchange of knowledge to better guide our practices? I ask this question because I'm working with Doctors Without Borders, and we have projects in many of the locations covered. It's good to not have to do a lot of the background research ourselves and have that functional exchange with academies.
Yeah, great question, thank you. And I think there's one more at the back as well. Like to come forward.
Briefly, thanks so much. One question and one very small comment. Question is, are these presentations available somewhere? Because those are interesting. And the comment very quickly. Well, I'm Javier Ramirez from Doctors of the World, Spain, and we are. I was wondering who is going to pay the bill for all those recommendations to be implemented. I mean, so sometimes I miss somehow some reference to the root causes of the need to fund and finance all these measures that needs to be taken place. So, from our perspective, if our rights perspective needs to be implemented, it means that the states needs to play a very strong role. So, how the states are going to get the revenues, the funds necessary to implement these measures without progressive fiscal systems, it will be really difficult for states to be able to implement this kind of recommendations. Thank you.
Thank you very much, and that's a really important point, the last point you made. I mean, we do know that if you quantify the kind of subsidies to fossil fuels and taking into account the health effects and the other externalities, they do amount to something like $5.9 trillion, something like that, according to the IMF estimates. So the logical thing would be to make fossil fuel prices and other sources of greenhouse gases reflect the effects. Of course, there's a long struggle to make sure that we do have adequate carbon pricing. But if it was implemented, it would provide adequate resources. Of course, it's a big political question as to whether it can be. And we know the struggle to even achieve the 100 billion. So it is an issue of social justice. The just transition is crucial. I think there's no simple answer to that, but something we all need to keep making that case, I think, for the future. So colleagues, any final comments? And by the way, I think the slides will be made available, Shada, is that right? Yep. Francis, yep, we will make those available. Yep.
Well, the funding is a very good point to raise. I mean, there is long-term, mid-term, and immediately. There is, of course, the possibility of having bilateral with the country you're working with. There's multilateral, and there's the UN agency. There's the Green Climate Fund, and I don't think many people are using it very well because there's lack of capacity, how to access it, knowledge, how to actually do it. And so this can be starting a seed to get the project jump start.
I think this is certainly something we should take away from this and see whether the inter-academy partnership with constituents academies can support countries in making better bids to the Green Climate Fund, including some of the health adaptation and mitigation. So I think these are useful suggestions we could take forward. Shirley?
Just a small comment on the question on how to engage. I think there's two things. One, I think that because this report is a little bit different than a lot of typical research reports or assessment reports that come from researchers, the focus on solutions and recommendations. I feel like that will hopefully provide an entry point for these types of discussions. And the second point is exactly that, is that I hope that these reports will provide entry points to discussions or presentations. So it doesn't matter, like where your organization is located. Hopefully there'll be some local researcher who is engaged in the reports who you could talk to and discuss these things further. So I hope, like in a small way, that's a way, like an entry point to get engaged and to try and move some of these things into action.
Oh, Kim, a final word from you.
Yeah, thank you. And we are at our time limit now. So clearly, we could carry on a lot longer on some very stimulating questions relating to who pays the bill and how do we engage. And perhaps we can carry on afterwards. It's my final task to just close on behalf of the Inter-Academy Partnership and to thank all the speakers, to thank the audience here and online for participating. I hope you all agree that this has been a wide-ranging and stimulating session that could, of course, go on for much longer. I think I hope we agree that worldwide that there are shared challenges and potentially shared solutions, customized, of course, as my colleagues have said, according to local circumstances and focusing on those groups who are most vulnerable around the world. But the lower and middle income countries, of course, fall into that category of vulnerability, and they've made the least contribution to greenhouse gas emissions, yet suffer some of the most severe consequences, and that does raise issues for equity, justice, and intergenerational fairness. And again, we could have discussed that at great length. You've heard about some of the work of the Inter-Academy Partnership and its regional networks and academies of science. And I think we recognize that there are continuing roles and responsibilities for all of us to continue raising the profile of the health issues in regard to climate change, to identify the research priorities to fill knowledge gaps, and indeed address the current skewed geographical representation and distribution of research. That does need addressing, and is another topic in its own right. And finally, I might just emphasize a point I made earlier as our responsibility to advise on the scientific evidence that's already available, not to allow politicians to defer decisions until we've filled some of the gaps. We need to act now on the basis of information that we already have available in order to take forward the mitigation and adaptation solutions, particularly in this context where there are health benefits to be gained. So thank you. Thank you all.